Hello there and welcome to the Clinical Radiology Department. You're viewing this video probably because you have an appointment for a CT scan at the hospital and you'd like to find out what's likely to happen when you arrive. Well, first things first. We carry out scans like the one you're about to have many times every week, and we understand you might feel a little apprehensive about it. But don't worry, it's a very straightforward process and you'll be well looked after while you're with us. The first thing you do is find the X-ray department reception desk and let us know you've arrived. The reception staff will invite you to sit down in the waiting area until you're collected by one of our department staff. When you arrive at the CT scanning department, you'll be asked to change into a gown.
You've got to undress and put one of our gowns on. Take everything off, leave on your socks, pants and shoes. Okay. And just come out when you're ready and take a seat in our changing room. Okay, thanks, Yes.
Once you're ready, the nurse will take you to our waiting area where she may give you a container containing a barium drink.
I'm going to give you this barium drink. The reason we give you this drink is so we can get better images.
This is a special liquid that enables the images that the scanner takes to give the medical team the best possible information in order to reach an accurate diagnosis of your condition.
And we've got a nice clear image of your bowels. Okay? So nice and slow, just nice 20 minutes period.
Are there any side effects?
No, not at all, no, not at all, no, nothing. So if you just drink this up and sip it, and I'll keep an eye on you.
And not too quickly?
No, not too quickly, over a 20-minute period at least, okay?
The whole of the liquid needs to be drunk, but don't worry, it's not too horrible, and we ask you to drink it slowly over a period of at least 20 minutes. When you've finished the drink, you'll be taken to the scanner room. The machine itself can look a little daunting at first, but it's perfectly safe and you'll be taken good care of. The scanner is shaped like a big donut and you'll lie on a special table that slides a little way through the middle while the images are being taken. Once you're comfortable, the radiographer will ask you to confirm a few personal details to ensure that the procedure won't cause you any problems. In addition to the barium drink that you took in the waiting area, it's often necessary to have a special fluid called a contrast agent injected into your arm. Again, this would be needed to provide sharp and detailed images from your scan. To do this, the radiographer will insert a tiny tube called a cannula into your arm. This is a simple process, just like having an injection, and it's over in a few moments. The cannula in your arm will be connected to a pump that the radiographer can operate remotely from his seat at the control desk. The radiographer will explain that when the fluid is injected into your arm, you'll probably experience a metallic taste in your throat and feel a warm flush pass down your body. You may even think that you've passed water. Don't worry, you won't have. It's just a sensation that the contrast agent can give. It's all perfectly normal and it's over in a few moments. Once the preparations are over, the table will be moved forward into position ready for the scan. At times during the scan, you'll be asked to hold your breath so that a crisp image can be taken. But it's not for long and you shouldn't have any problems with it. The radiographer will then go to the control desk and start the scan. A typical scan can take up to 20 minutes to complete, and during this time the table you are lying on will slowly move as the images are being taken. You won't feel anything as the scan takes place, so much so that some patients have even been known to nod off during the process. The CT scan will allow the medical team to visualise what's happening in the organs and blood vessels within your bowel, and this will enable them to reach an accurate diagnosis of your condition.
Okay, that's all we need. The nurse is just coming through to get you off the table now. Thanks, yeah, perfect.
After the scan is finished, the nurse will help you from the table and take you to sit down for about 15 minutes before removing the cannula from your arm. Then, When you feel ready, you're free to head off home. A little later, a specialist will examine the images from the scan and the results will be passed on to your doctor. Our aim is to make your visit as comfortable as possible. If there's anything you would like to know, please ask any of our staff and we'll be very happy to discuss things with you. We're looking forward to meeting you.